This is the AAOS Career Podcast, part of the Bone Beat Orthopedic Podcast channel. This series features conversations on professional development and growth opportunities within the field of musculoskeletal healthcare.
Hello, everyone. I'm Rex Lutz, chair of the Resident Assembly Executive Committee, and this is the AAOS Career Podcast. I'm honored to be joined today by Dr. Coleen Sabatini, recipient of the 2025 AAOS Humanitarian Award. Dr. Sabatini is a pediatric orthopedic surgeon at the University of California, San Francisco, Benioff Children's Hospital in Oakland. She has worked to improve access to high-quality pediatric care around the world in resource-limited settings. Dr. Sabatini will be sharing her experiences and expertise and the value and importance of humanitarian work for orthopedic surgeons and trainees alike. Dr. Sabatini, welcome to the AAOS Career Podcast.
Thank you, Rex. It's nice to be here with you.
First off, I just wanted to congratulate you on winning the AAOS Humanitarian Award. It was very well deserved. What did this mean to you to win such an award?
I was very moved by being selected for this award. I feel like it came pretty young in my career. I'm about 15 years into practice, and to have the work that I've been doing acknowledged in this way has been phenomenally meaningful, mostly because I hope that it has brought some attention to my colleagues in other countries where I work, predominantly in Uganda. I have a phenomenal team of friends and colleagues that I work with there, and the opportunity to highlight the efforts that we've made to try to expand pediatric orthopedic education and pediatric orthopedic care in Uganda and the work of others throughout East Africa. I appreciate the Academy acknowledging the work and the efforts and hopefully raising awareness that there are many opportunities for our colleagues here in the United States and elsewhere to be contributing to the education and support of surgeons in places that don't have the same access to resources that we do here in the United States. And there's such a phenomenal impact that we can make as surgeon educators who are focused on teaching and supporting our colleagues in other countries rather than just flying into places, doing some surgeries and leaving. So I hope that through this, we can really raise the awareness about the importance of focusing on education and capacity building efforts in orthopedics in order to really have meaningful impact and change over time.
Yeah, it's one of those amazing awards for you because not only is it for you, but it is for everybody else. And it just really demonstrates what you've done for everybody else. So again, congratulations on your award. It's a very high honor. Regarding public health and public service, when did you start doing this kind of work? Was it before medical school, during medical school residency? When did that start?
Yeah, my passion for public health really started in college and probably even earlier, like through some volunteer opportunities that I took advantage of. And when I was, growing up, I grew up in Colorado and did some work in junior high and high school in migrant farm workers and sort of other populations that were historically underserved and marginalized. I think that started to raise my awareness of the importance of public health and community service work. And so that continued into college. And when I finished college, actually, my thought was I was going to go into public health. So I worked for the County Health and Human Services in the County of San Diego after I graduated from UCSD as an undergrad. And it was during those couple of years that I actually got interested in going to medical school as well. So I went to medical school thinking that I was going to do public health, community health-based work. Did not actually think about a career in orthopedics because I didn't have the greatest of experiences as a young person with the orthopedic surgeon in the community that I grew up in. And so it just wasn't a field of medicine that I had really been exposed to, but came to love being in the operating room, which was honestly a little bit of a surprise to me for what I thought I was going to go to medical school to do. And then I was very fortunate to be at a medical school that actually required an orthopedic surgery rotation. And so I did 2 weeks of orthopedics at the Children's Hospital of Boston as part of my training. And that is what exposed me to orthopedics. And I was hooked from that point forward. And it actually took me a little while to figure out how was I going to merge this emerging passion for orthopedics with this long-term commitment to global health and community health equity work. And I figured that I would make it up as I went along. And so, because during medical school, I was involved in a lot of community service outreach with related to healthcare. I did some volunteer work in the Dominican Republic for a few different trips during the time that I was in medical school, and then tried to figure out how to merge the orthopedic passion with that. So I was fortunate that I was able to do some work as an orthopedic resident, also in the Dominican Republic. I was in Boston, and so that was a natural connection to do work in the DR and participated in some programs there, and then knew that was going to be something that was going to be integral to my career as an orthopedic surgeon. And so that's why I ended up at the University of California, San Francisco, because of all the programs in the country. It has the longest standing and I think most entrenched commitment to global health work of all of our orthopedic programs. So I joined the faculty here 15 years ago for the purpose of having some other kindred spirits to work with in order to focus on a career in global orthopedics.
You bring up a good point about there not really being a path and you were just making it up on the go. And really that speaks to you. You're blazing the trail for this kind of work and humanitarian work in the orthopedic field. I know there's many others who do the same, but it's not very common. It's really some amazing things that you do. So you mentioned in residency, you volunteered. That was with Operation Walk, from my understanding.
Yes.
So what was that experience like going? It was internationally, right?
Yeah, it was in the Dominican Republic. So you as a future arthroplasty surgeon probably should, hopefully you know about Operation Walk. But we were just starting an Operation Walk Boston chapter at the time that I was I think fourth year orthopedic resident. And that was Tom Thornhill and Dick Scott were the two, those are major names in arthroplasty. I'm a pediatric orthopedic surgeon, so those names might not know as not mean as much to my peds colleagues, but certainly to you and others who are going into arthroplasty. Those are just some, absolutely phenomenal arthroplasty surgeons. And so Drs. Thornhill and Scott were starting an Operation Walk chapter in Boston. And at the time, Harvard the residency program didn't have like a global health option for residents. And so I actually distinctly remember the memory going to Tom Thornhill and saying, hey, I hear you guys are doing this. I've worked in the Dominican Republic before. I'm very committed to global health work, and I would love to be able to help in any way on the Operation Walk work. And can I go? Can I help? I will wash the floors. I will do anything that needs to be done. I just want to see how this works, how this looks. And so I was very fortunate that I was invited to go. So I was the first resident that went with them. And I'd like to think that I did a good enough job that subsequently on all future trips, they had multiple residents that they took with them. And that became the Harvard sort of global health experience for a number of years, was participating in the Operation Walk work. I think for me, young in my career, since I was just still a resident, it was great to see the level of pathology that exists in other places, right? I think for me, that was the most striking thing to really be confronted with. We have the luxury of being able to provide healthcare in this country to people quite early on in many stages of disease. And to see people with such horrific osteoarthritis was something that was very new to me. So the pathology was phenomenally interesting. And so I loved that part of it. I loved the fact that even though it was sort of a mission trip, we actually worked with local residents. We worked with local medical students and physical therapists, and we were providing education and exposure to them. And I think that's really important and meaningful, even if you are doing fly-in, fly-out surgery work. And just seeing how orthopedics is practiced in different settings, I think is another thing that it really started to raise my consciousness of. So I was able to do a couple Operation Walk trips as a resident, and that was wonderful. But those were just really phenomenal experiences early in my career for me to really accept that this was something that was going to be a part of my orthopedic life, and not having some of those exposures and opportunities was going to be unacceptable, right? So it really solidified my passion and commitment, I think, to that work. So I love to see, residents being involved in outreach and education work, and hopefully that inspires other people to get involved as well.
Yeah, Operation Walk's a great experience. I have had some experience with that. For the listeners who may have not know much about it, there's the Operation Walk International, and then there's actually some in the United States, Operation Walk in the United States. So I actually had the opportunity before I was even in medical school, because I couldn't go on these trips necessarily, but I helped organize some stuff in the United States with Operation Walk USA, which is just a counterpart for those in need of hip or knee replacements who are underinsured or uninsured and can't afford a surgery but are in desperate need of the surgery. We were able to provide some. So that was a really rewarding experience as well. So there's different ways to get involved at different levels of training. You just have to think outside the box and keep kind of asking around until you can find a way to provide value to the cause.
Yeah, and honestly, just to acknowledge, Operation Walk originally was started by a orthopedic surgeon by the name of Lawrence Dorr out of Los Angeles. And I think he's a past also Humanitarian Award winner for the Academy because of his work in Operation Walk. And then there's been subsequent growth of other chapters in different cities that then do work in different countries. And like you said, also have domestic work, because certainly you don't have to leave the United States to address disparities in healthcare and disparities in orthopedics. We have lots of inequities in the U.S. in terms of who has access to orthopedic care. And so I think that's amazing that there's a domestically focused Operation Walk chapters that are trying to bring care to people who otherwise would not be able to access it. So we need to continue to do work both domestically and globally. And always remember, that we need to be humble. We have a lot of things within our own system that need to be fixed and addressed before we tell anybody else how they should be doing their care.
Yeah, well, very well said. So you talked about the fly in, fly out kind of model. What did you learn from that? Because now you're really focused on resource building. So you go out there and help build the resources within the community to help sustainability with healthcare within this particular communities. So how did the Operation Walk experience shape that idea of resource building for you?
Yeah, I think that experience, as well as some other ones, right? Like, again, loved the opportunity and what it brought to me in terms of what I was able to see and learn, but also that it's not a sustainable impact, right? And that many of the fly in, fly out surgery programs that exist are, sure, they're absolutely fantastic. The kids and the adults who get access to surgery during that time are probably having a life-altering and changing experience, which is wonderful. But then if we haven't done anything to improve access to care to all of the other people for the 51 weeks a year that mission isn't happening in that country, then what have we really done that's sustainable and impactful beyond just doing good for a few folks? So I think that for me, it was, again, seeing the impact that you can make on individuals, but also seeing the phenomenal importance of, okay, but when we're not here, who's providing these implants, who's providing this education, who's creating this access. And that's what's important if you actually want to create change. And so my interest, moved into East Africa after I started my career. And to use Uganda as an example, when I started working in Uganda, there was no pediatric orthopedic surgeons in the country, right? So for a person to fly in and do a few surgeries and leave has far less significant an impact than teaching local surgeons in pediatric orthopedic principles and care, and then having local people be able to provide that care day in, day out. And it's just an exponential impact then, far beyond what you can do with a mission trip. So that's where I just philosophically started to shift. The need is so great that just scratching the surface with a trip or two a year isn't the impact that I think we need to be making.
Yeah, it's that old saying, you give a man a fish, they eat for a day.
Yep.
So what's your kind of, I understand you go to Uganda for quite some time. What does your year look like as far as these mission trips? Are you there for a really couple months at a time?
Yeah. So I think just since this is a career podcast, I'll sort of do a little bit of background on the evolution of my global health work, because I think it's really important for particularly young surgeons to understand that you don't just, most of the time, you don't just start doing this work, right? You have to learn orthopedics too and establish yourself. It's a lot different to be a resident with an attending in the room making final decisions than it is being the attending with all the responsibility on you. So it's important when you're first starting out your career to make sure that you focus on, solidifying your own skills, experience, confidence, and all of that before you go and try to tell other people how to do stuff in other places. And so I started my first few years in practice. I solely focused on establishing my practice and getting my sort of surgical chops in order. And then I started going about 3 years in. I did my first education trip to, it happened to be Uganda. I had reached out to a pediatric orthopedic surgeon that was working in East Africa, Norgrove Penny from Canada, and asked if I could accompany him because he had lived and worked in Uganda for a very long time. And I asked if I could accompany him, and he was gracious enough to allow me to go on his next trip, which was an education trip focused on chronic osteomyelitis education through the Canadian Network of International Surgeons. And so I went to Uganda, and that was my first time in East Africa. We were there to teach a course, which was a little bit ironic because they probably know way more about chronic osteomyelitis than we do. And that's where I've learned all of that I know about chronic osteomyelitis is from my work there now. But we were teaching, medical students and general surgeons about how to do sequestrectomies and corticotomies and things like that. So I felt confident talking about those things. And it was through that first trip to Uganda that I was really inspired to continue to go back. One, because again, there's, a huge population of children with no access to trained pediatric orthopedic surgeons. There was not a lot of pediatric orthopedic education in the residency program at that time. And there was also some interesting some kids that I met while I was there that had some conditions that I was particularly interested in because they're sort of intersectional between public health and orthopedics. And so that started me going, wanting to go to Uganda more. My first 3 years in practice, I didn't go anywhere. Then for the next 6 years, I started doing just short trips to Uganda where I'd go for 2 weeks at a time, 3 times a year. So a total of 6 weeks, which was a combination of vacation time and some research time. And I was mostly focused on research and education work while I was there. And that became very clear to me over that period of time that going for short times and not really being there more than what I was doing was not really going to allow me to integrate enough into the team and to see and learn enough to actually then be able to have an impact. And so in order to be able to be there more, to solidify more of the educational work we were trying to do and do more in terms of the research work, I actually went to my chair at the time and said, I would really love to spend more time working overseas. Can I do that? What does that look like? And he was like, well, how much time would you want to spend? And I was like, 50%. Assuming that he was going to tell me no, but he actually said, well, I'm going to pay you less. And I was like, of course, but it wasn't no. And so from that point, we started some negotiating. I was the chief of service at the Children's Hospital in Oakland at the time. And I stepped back from that role and took a bit of a pay cut, but that was to be expected. And then was able to start going to Uganda. Basically, I now spend about 3 to 4 months a year there. And then sometimes I do some work in a few other countries doing some educational trips, mostly through our Institute for Global Orthopedics and Traumatology here at UCSF. And then if I go to conferences or anything for both domestic or abroad, that comes out of that time. And so I basically have a job where I'm 50% clinical at my primary site here at Oakland Children's Hospital, and then 50% sort of global time. And there's now a few other surgeons at UCSF, not in orthopedics, but in other fields that have jobs like that. And there is at least another orthopedic surgeon in the country that has a similar type model. And, maybe this is something that we'll see more of in the future. I think it's important. I think the 2 important things to hear is that 1, you have to make sure that, you're solid in your own practice. And that 2, I think at least now there's nobody that's going to make full-time salary doing part-time work and then part-time volunteering. And it is truly volunteering. And so as long as people understand that that's the sacrifice that you make in order to do this, ideally someday there'll be enough funding out there that we can support full-time salaries for people who are doing this type of volunteer work, but it's not the current climate.
Yeah, I'm sure many patients that you've impacted, not just you personally, but from the people that you have trained, really appreciate what you're doing. I think that goes for everybody that's probably listening here. Just thank you for all that. That's really amazing for you to do that. So we appreciate that. What is something that you've learned being in Uganda as far as the underserved areas and what resources are limited, and what was the shock factor when you got there where you're like, wow, we have this stuff in the United States and they don't even have any of these resources available, or they're missing this piece of education or this piece of training. What shocked you the most there?
Yeah, I think the pathology is actually the most shocking. We have angular limb deformities, for example, right? In America, kids with genu varum and genu valgum, nothing like you see in other places in the world. Everything I know about rickets, I learned there, not here in the U.S., right? I learned in Uganda. Bone infections here, right? They're often caught and treated with antibiotics and don't progress significantly. 20% of our surgical population at the hospital that I work at in Uganda is chronic osteomyelitis with severe bone loss. And so seeing the team over there actually is phenomenal in how they treat long segmental bone defects. And I think I've learned a lot from them on that. So I think the pathology and just congenital conditions that are not able to be addressed until the child is significantly older And so, even clubfoot, which is one of my areas of focus, I meet babies practically in utero here in the US, and we start their casting, at 1 to 2 weeks of life. And over there, we sometimes don't get to meet kids until they're 15 years old. We also meet a lot of babies, and there's many more babies that we take care of there than I might in my own practice here. But just the breadth of pathology is very different. I think other things that were surprising is that, or just, I guess, just make me take pause all the time, right? Is that here in the US, I have floral machines that work all the time, and we have electricity and running water that's predictable. And that's not always the case in all the centers that I've had the opportunity to work at in other countries and in Uganda. And I think there's a lot that we take for granted here, right? If you're doing a case and you need something else, you can call for it and it comes right up from CPD and you keep going. And over there, we have to be much more thoughtful, like ahead of time, to make sure that we have the equipment that we need, because you can't necessarily go and ask for a different tray. And you don't always have like all the screws that you want or the right plate, right? Like, we're so fortunate here that we truly have anything and everything that we could really want. And the rest of the surgeons of the world do not have that luxury, and they have to be a lot more thoughtful and a lot more creative. And I've learned so much about trying to not overutilize resources, because here that is not ever a message that we are taught. And over there, even like being conscious of how much suture you're wasting is something that you really have to think about, because the resources are very limited. I actually think that's why it's so great when our trainees have the opportunity to go and work and learn from people in places with less resources, because it teaches us to be a lot more thoughtful about how we utilize resources in our own system. And I think it teaches us a lot about how we can provide better care to our own patients based on what we learn and see in other places.
That was going to be my next question. What from over there have you learned that you've applied to your practice? But it sounds like it's a lot, and a good experience for anybody listening to get involved with something like this. So I guess with your specialty and something like clubfoot casting, it's definitely an art, and doing that well, but teaching somebody to do that and doing it in someone in such a young age, like an infant, can change someone's life forever. And
Absolutely.
The benefits they may not see now or realize now necessarily, but like in 15 years, when you have that 15-year-old child with clubfoot and they don't have clubfoot and they don't need surgery, and really those benefits are going to go on for such a long time for those people. And being able to teach someone how to do that, you can catch them early, require less surgery. And actually that's saving a lot of resources, because casting material is then needing surgery.
And big surgery, yes.
That's very cool. What would you say some of your most memorable experiences are in your service work that you do for others?
I think that there's so many. I think most importantly is just the relationships that I have been able to cultivate. I think both with the patients and with my colleagues has been the most fulfilling part of the work. We know that in our own practices here, right, at home, is that the people that you work with, like, they can really make or break your experience, right? And having a good relationship with the people that you work with is really important. I spend less time in Uganda than I do here, but not really by much. There's not that much of a difference. And I will say that I probably have closer relationships with some of my partners in Uganda than I do even here in the US, just because we're always running around to a bunch of different sites and don't necessarily have as much opportunity to work together. And over there, I'm always working with another member of the team, right? So I'm there as an educator. So if I'm in clinic with like our pediatric orthopedic fellow, or one of our other like young pediatric orthopedic surgeons, where we're working together. I'm providing education and feedback and guidance, and but also always learning something from the patient, the parent, or my colleague. And so I think that the relationships that I have with them, like, they are just as much my partners as my partners here are. And some of them are very much my family at this point, right? I've been going there for many years, and I'm like the auntie to the kids and the, a member of the family. And I appreciate that, right? I appreciate being a part of a community that way. And so that part has been phenomenally meaningful to me. I think there's so much that we can help bring to the table. It's not just about teaching orthopedic skills but also like hospital administration, right? Some of the people that I work with and that I have conversations with, it's about running of the hospital and what are ideas for improving access and billing and all the things that we deal with over here. And obviously our systems are different, but a lot of the challenges are the same, right? And so we can learn a lot from each other about just how we run systems and how we organize surgical lists and all of that. And those are, I think, really meaningful conversations that I'm able to have with my colleagues over there and being able to make an impact, again, even just beyond just the orthopedic education, but like systems change, resource development, advocacy work, I think has been really meaningful for me to be a part of and to bring back. I'm grateful that I'm a part of the community over there, right? So when I'm there, I go to the Orthopaedic Society of Uganda meetings. I'm a fellow of the College of Surgeons of East Central and Southern Africa, and being a part of the surgical community there has been amazing. I appreciate that they have welcomed me into the organizations and just working with people, not just from Uganda, but all the surrounding countries, has been fantastic. And so there's a group of us that are focused on pediatric orthopedic education in the whole region, not just in our individual countries where people are working. And there's now 4 pediatric orthopedic fellowships in East Central and Southern Africa, and having those work together, share curriculum, share ideas, all of that I think is really important moving forward, so that we can expand educational opportunities for more surgeons in the region, because there's so many people that need access to orthopedic care. So just being a part of all of that to me is like the most meaningful and powerful thing that I really appreciate like every day.
Yeah. I guess in my mind, when I picture you going to Uganda, I picture you like going there, doing surgeries and being on your own, but it sounds like you've really integrated into the community, which is probably very rewarding in itself.
Yeah, well, that's the whole idea of capacity building, right?
Yes.
I'm not just going by myself and like doing a bunch of surgeries. Like I'm going and I'm there as an educator, just like I am here, right? Where I have residents and medical students that I work with here when I'm in the US. There, I'm providing orthopedic education to, again, we have a pediatric orthopedic fellowship now at this hospital for the goal of training more pediatric orthopedic surgeons. So fellow, we have residents, and then we've trained a few pediatric orthopedic surgeons now. But like any of us in practice, right, it's 5 to 10 years before you feel like you've like seen everything enough to start to feel comfortable, right? Yeah. And it's really helpful to have other people around who also know something about your field and can, give you advice and guidance or help with a challenging patient, right? And I'd tell you there's pathology there that I see that I don't know, and I have to go read about it, right? Because I've never seen it here in my practice in the US. And it's like, I never get bored, right? There's never a moment where you're just like, oh, I feel like I know what I need to know, right? It's constantly being challenged and constantly be inspired to like go and read and learn and like find new ways to take care of problems that you might not have even known existed, right? So it's like a constant just invigoration, and I never get bored ever. So it's pretty phenomenal. But yes, so I'm definitely not there just doing surgeries on my own. That's the difference between being a mission surgeon and being a sort of capacity building focused surgeon. So those of us who do capacity building focused work are there to provide education, both in terms of surgical training, but also, how to do research, how to lead divisions and departments in hospitals and those types of things. And that's where the impact will be made, right? If it was just me doing my own thing, I'd do however many surgeries in the 4 months that I'm there. I'd go home and do my work here and then go back and forth. But the work that we're doing now, we're training pediatric orthopedic surgeons, and that's going to change the whole way that orthopedic care is delivered to the 28 million children of Uganda. And that number is only going to get bigger and bigger over time, right?
Yeah, and I just wanted to drive that point home because I think it's just very easy to think what your idea of a mission trip is or the trips, but it makes you think differently about the whole situation and how you can truly contribute to a community.
It's definitely less common in orthopedics still to have people that are focused on the education and training part. We still have a lot of people that are doing more mission type fly in, fly out surgery. And again, I think if those are done well, where they're done in partnership with local surgeons and where there is education focus, right? You're trying to help build experience and exposure to local surgeons. I think that's great. Or if you go to the same place all the time and you have a good relationship and you're doing follow-up of your past patients and there's some way to deal with any complications if those arise, like all of that. So I don't want to say that that's not the way to do it, but I think that if you're going to do that type of work, you have to be very sound in your in your ethics of it, and ideally try to include some capacity building focused work there. But that the impact will certainly be greater if we can train surgeons in various places to then provide that care on a daily basis, right? That there will be far more patients that benefit from that than us flying in and doing a few surgeries. So,
Absolutely. What advice would you give to a resident or a fellow or a young surgeon that wants to get involved? Like, what resources are available for them to start to get their feelers out and find a
yeah.
way to contribute?
So I think that it's been really exciting for me to see in the last 15 years that I've been in practice how many young orthopedic surgeons are interested in this work, right? Because when I made the decision to go into orthopedics as somebody who wanted to do global health, I thought I was a little bit alone in the world. And so it's so fantastic now to see how much interest there is. And the first thing that I always say is, first and foremost, your responsibility is to learn to be the best surgeon that you can be. And if you really want to help and make an impact, learn your craft optimally. So read, study, do well on your OITEs, do well on your rotations, practice, read things that are not just from our great journals here in the US, but from international journals that often publish on things that were on conditions that are seen by many more people in the world than what we see in the US. So I think making sure that you're honing your craft is first and foremost. But beyond that, like getting involved, I think there's more orthopedic surgeons that are interested in this work now than there was before, and certainly starting locally. And if there's anybody at your institution that's doing any of this work, whether that be mission surgery or capacity building focused education, reaching out to them and hearing about what they are doing. A number of organizations exist that do global health work. We actually published in the AAOS ICLs a few years ago, a whole thing on global volunteerism that sort of has a list of various organizations that people can volunteer with. Again, those tend to be more mission sort of surgery-based fly in, fly out stuff. But there's also organizations like Health Volunteers Overseas, which used to be called Orthopedics Overseas, which is education focused. And there's lots of opportunities there for residents to go and do, a month-long rotation in a place. And just starting to get exposure, I think, is really important when you're younger. We've already talked about Operation Walk. There's the Hand Society has a Touching Hands program that does outreach work. Many of the subspecialty societies have that. POSNA has the core committee. It's now called the POGO committee, which has resources for people who want to do outreach work. So many of the subspecialty societies have international sort of committees that you can reach out to and get volunteer information from. But also there's the group of us that do this work. We're always happy to chat with young people and hear what their interests are and help connect them with people that maybe are doing work in the area of the world that they're interested in or in the subspecialty that they're interested in. And so happy to help make those connections. But yeah, so first and foremost, hone your craft, be the best surgeon that you can be, and then start to reach out and chat with people who are doing this work and hear about the different ways that people are doing global health work and how you might want to incorporate that into your practice. Not everyone financially is able or willing to take the hit that some of us do to spend a huge amount of time overseas, but even if you're just taking a week or two of your time to go and be an educator and help out with complex cases and things like that, that makes a huge impact. And so I think there's lots of different opportunities depending on what people's level of commitment is going to be.
That's great advice, and we thank you. And I think a lot of the listeners will appreciate you giving us that advice. But I wanted to say thank you, Dr. Sabatini, for joining us today and just your dedication to this humanitarian work and the musculoskeletal care of all these children around the world. We appreciate it, and they definitely appreciate it. So thank you for joining us today.
Thank you so much. I appreciate the opportunity to chat with you.
Thank you for listening to this episode of the AAOS Career Podcast, part of the Bone Beat Orthopedic Podcast channel. Hosted by Dr. Rex Lutz and featuring special guest Dr. Coleen Sabatini. Production and editing by MK Quinn Media. Check out the video version of this podcast on the AAOS Career Podcast YouTube channel. And to hear other conversations on professional development, please visit aaos.org/The Bone Beat.